News now. We have confirmation that Fotis Dulos is in fact alive. We are told he is going to be going to Jacobi Medical Center in the Bronx because where he's being treated at the UConn facility, they do not have a hyperbaric chamber, which apparently they need for toxicology treatment because of being in the garage with the car running and the carbon monoxide poisoning. That's new, just finding out moments ago.
Yes, and in fact, we have an expert on the phone right now, Dr. John Delgado. He is a toxicologist at Hartford Hospital to explain. Dr. Delgado, how does this treatment work, and is it effective?
Well, there are two reasons why you might do this. The first is if there's still carbon monoxide in the system, it really helps to get rid of it much quicker than you would just by breathing air. So if you're breathing air, typically it's in the range of 2 to 4 hours for you to get rid of carbon monoxide. Whereas if you put somebody in a hyperbaric chamber, it brings that down to a matter of minutes.
Dr. Delgado, tell us what, for folks who don't know, and I've got a foggy idea of what this is, but a hyperbaric chamber is just that, a chamber where pressurized oxygen is put in, is that correct?
That's right. So they come in two flavors, if you will. One is a monoplace, or where a single person can be slid in and almost looks like a clear coffin, and where the cover is put on and then the chamber is pressurized. There's a second kind of chamber where multiple people can go in it at the same time. But they all accomplish the same thing, which is to deliver oxygen at much higher pressure than you could just by breathing air at sea level.
So how effective is this treatment?
Well, that's a matter of debate. The main reason to do this in most patients is to prevent the devastating sequelae, or the devastating consequences of carbon monoxide poisoning, which typically affect the brain most severely. So the thought is by putting somebody in the chamber, it decreases the inflammation that people experience after an exposure to carbon monoxide, and it helps to decrease the damage down the line. So there's some controversy as to how effective it is. I think most of us, in patients who are very severely affected, we tend to do it, but the data is far from clear on the degree to which it helps.
And what we're seeing here on the screen as we talk to the doctor, this helicopter is apparently the one that is or about to be used to transport Fotis Dulos to the Jacobi Medical Center in the Bronx. And doctor, as this unfolded today, paramedics worked on Fotis Dulos in the driveway of this home in Farmington for some time. I don't know exactly how many minutes, but it was long enough that police had put tents up over the area for privacy on what was happening. I'm not a doctor, I don't understand this, but when the longer we go apparently without signs of life, that can lead to things like brain damage, that kind of thing. Take us through that.
So yeah, the brain is very, very sensitive to oxygen deprivation. So within a matter of seconds, really, you can start to see some evidence of damage. We really have only a matter of minutes before irreversible damage is done. So the longer you wait, the worse it is. And I would say beyond 10 minutes of really no heartbeat, the chances of brain damage are almost guaranteed. So it really is a matter of how much damage occurred during that time until his heart was restarted.
Dr. Delgado, why is he being flown to a facility in New York for a hyperbaric chamber?
The number of chambers that are able to do this kind of treatment are not that many. So hyperbaric is most commonly used in this country for wound care, but a lot of the facilities that do hyperbarics for wound care are not equipped to take critically ill patients, like patients who might be on a ventilator, for example, and manage them during that treatment. So there's only a handful of facilities that would be able to take care of somebody like this.
So that said, does that speak to how serious his condition could be as we watch the live scene at UConn Health Center as Fotis Dulos is about to be flown to that facility? But does that speak to how serious it could be?
Absolutely. You would only do this if or for the patients who are most severely affected. And the fact that there was CPR performed, if that is in fact accurate, is just a very, it's a signifier of a very severe injury.
All right, as we go back, our photographer repositioning there to try to see exactly what's happening. We can go back to that camera, even if it's moving around. Let's see what's happening. And doctor, so there aren't that many of these chambers around. Were there more at one point, and there are fewer now? Or explain that to me.
I'm not sure exactly what the trajectory has been. I can tell you that most chambers that are used in this country are used for wound care.
Okay,
so,
Dr. Delgado, we just want to dip in a little bit here. We're watching ambulances pull up to the medical helicopter at UConn Health Center right now that is to take Fotis Dulos. So let's see if this is the patient about to be taken out of the ambulance as we watch this unfold live.
I didn't see the rotors on that chopper going, so I'm not sure what the procedure, but you can see they're kind of pulling another UConn vehicle up there. This backing up to where the helicopter is now, and you can see that paramedic or officer backing that up. There's a stretcher waiting there, and apparently that is where Fotis Dulos is going to get out of that vehicle, apparently onto that stretcher and into the waiting helicopter. There doesn't seem to be a great urgency here. These guys obviously are not moving quickly at this point. I don't know if that means he is in stable enough condition that this is not an urgent event, but obviously urgent enough as they get LifeStar ready to make this trip from UConn to the Bronx here.
To Jacoby Medical Center for their hyperbaric chamber.
Yeah, all right. And watching this here, doctor, is it unusual? There seems to be no urgency with these crews. Help me understand how that could be.
Well, recall earlier I said there's really two reasons to use hyperbarics. In this case, since he's almost been on oxygen therapy since he's been under medical care, almost certainly all the carbon monoxide is gone. So the reason to get him to a chamber is to help prevent those delayed consequences of carbon monoxide poisoning. And in that case, you want to move relatively quickly, but there is no urgency to it, right? As long as you get it done within a matter of hours, then presumably you get the benefit.
So again, if the carbon monoxide is out of his system, the chamber is to what? To try to repair function to these tissues that were starved? Tell me again what the issue is?
Sure. So tissues that are deprived of oxygen, when they receive oxygen again, there's a big inflammatory burst. So all that inflammation causes damage. And the thought is that hyperbaric can help tamp down that inflammation so that the damage isn't quite as extensive.
All right, we see the UConn Fire and Rescue crews there holding a sheet. We don't know if that's going to be to shield what the media can see, holding something that appears to be some sort of a gas bottle, oxygen bottle or something. But again, as the doctor said, no time urgency here at the moment. But again, the confirmation we have here that we just got in the last 10-15 minutes is that Fotis Dulos is not only in fact alive, but is being transported as we speak. And you can see crews are kind of shielding what we can and cannot see.
Yeah, doctor, do you think he's breathing on his own? Is there any way to tell?
I doubt it. Somebody who's had CPR and has had this degree of poisoning usually is intubated and placed on a ventilator.
Here comes Fotis Dulos apparently out now and on that stretcher. And as you can see, emergency crews holding that sheet in the breeze there this afternoon, putting him onto the stretcher, and the LifeStar helicopter is awaiting him being transferred. It has been a surreal 3 hours and 21 minutes in Connecticut today as we watch this unfold live here on News 8.
So this is Fotis Dulos being transferred from UConn Health Center, where he was in critical condition, being treated for carbon monoxide poisoning in a suicide attempt in his garage. Yeah. Late afternoon, he did not show up for his bond hearing in Stamford. Police performed a wellness check and found him in his vehicle in medical distress. They got him out. They performed CPR extensively. They took him to UConn Health Center.
Yeah, state police say he apparently tried to kill himself in his garage by getting in his car and running it. The wellness check came. Officers looked through the window, saw Fotis Doulos in his vehicle, in his garage, went in, pulled him out, put him down on the driveway, and began CPR. And that unfolded about 3 hours and some minutes ago. Unclear here of the exact timing. That's an empty stretcher. I don't know if they transferred him to one stretcher or the other. You see the yellow legs of the stretcher that is in use now as medical personnel doing something. You see some straps hanging there as they once again begin the process of getting him into the helicopter.
Dr. Delgado, I just want to ask, how long would someone like this condition be on breathing assistance? Okay, I think he's...
Doctor, you there?
Oh, yeah, sorry. Can you ask the question again?
Sure. How long would someone in this condition need to be on breathing assistance if they survive?
It really depends. Usually you don't know right away. You have to wait a few days to see how much brain function returns, to see what the long-term prognosis is.
And doctor, how long does somebody in this kind of situation stay in that chamber? Is it hours? Is it days? What's the process?
It's typically a few treatments over a day or two. Patients will often go in for a few hours at a time and then come out, go to the intensive care unit, and then have another treatment or two in the next 24 hours.
Okay. If you're just joining us here as we near the bottom of the hour, that is Fotis Doulos, who's being transferred from the UConn Center to Jacobi Medical Center in the Bronx to be treated with a hyperbaric chamber after this carbon monoxide poisoning. Apparently tried to kill himself today in his garage in Farmington. And this process taking some time to unfold here as we are on the phone with Dr. John Delgado, who's a toxicologist from Hartford Hospital. We see now the progression of Fotis Doulos being brought to the Lifestar helicopter, shielded from the media there, watching this all unfold. Accused murderer. We still don't know where his estranged wife, Jennifer Doulos, is. We do not know if he left a note. We do know he is alive and about to be transported. And as we watch this unfold here, you see the UConn police there as they put him back into the Lifestar. It shouldn't be a long flight from there, you know, from there to the Bronx. And another vehicle, police vehicle, pulling up there as well. And this surreal day gets more surreal by the minute. Doctor, how often in a case like this is there, and I know it's so hard to, you know, we're watching this unfold, somebody with this kind of treatment, full recovery is possible from something like this, is it? It depends on the length of time without oxygen, correct?
It certainly does. I would say the fact that CPR was performed is a very, very poor sign, and I would say unlikely to regain his former status, just based on that fact alone.
And again,
I'd be very surprised.
And the biggest danger we're talking about in a situation like this, is it the brain that is the most critical to not have oxygen for that period, correct?
That's right. The brain damage is likely severe.
Yeah, okay. Well, we just saw somebody else get into the back of the helicopter there, getting close by. Again, for a non-medical person, it seems odd that there wouldn't be urgency, but as the doctor said, at this point, this poison gas is probably out of his system. But the question is now, what kind of repair can be done with these hyperbaric chambers? Doctor, is this the closest one that you're aware of would be at this center in the Bronx? Is that the nearest hyperbaric chamber?
That could take a critical patient. I'm not sure, actually. I think there might be one in Rhode Island, but it really depends on the availability. So just because there is one closer, if they can't take the patient right now, then I'm sure they went with the one that was closest and was available.
Right. And Hartford Hospital, and again, to recap here, had one at one point but no longer does. Is that correct?
That's correct.
And what
we used to have a large one, a multi-place one, but we transitioned away from that, and now the ones we have are used for wound care only.
Right. And I would assume that is a piece of equipment that doesn't get a whole lot of use on a normal basis, correct?
Well, for wound care, it actually gets used quite a bit. But for the other indications like this, carbon monoxide, it would be a pretty uncommon indication.
How does that help with wound care? What does a hyperbaric chamber do for wounds?
Well, a lot of wounds are related to poor circulation from diabetes, for example, or vascular disease. And what the hyperbaric oxygen treatment does is it improves the oxygen delivery to the tissue so that the body can heal itself, basically.
Okay. And is there, as he's being transported, would there be any special medical treatment in the chopper, or is it just simply oxygen? I'm sure he has medical personnel monitoring back there. How does this transport work?
Yeah, it would be the standard critical care transportation team. He would be maintained on a ventilator with the highest flow of oxygen feasible, and just routine care to maintain his vital signs.
Okay, we see the pilot who is going through his pre-flight checks. We can see some flashes of light there on the Lifestar helicopter as they prepare to take off, heading for New York, for the Bronx. Doctor, what else can you tell us about carbon monoxide poisoning? Is it, what does that do to the body? And it is simply a starvation of oxygen, is that correct?
It's that, certainly, but carbon monoxide is especially bad for cells. It causes this pretty severe inflammation. So the organs that are most sensitive to oxygen deprivation, the brain, the heart, are usually the hardest hit.
Right. I'm joined here, News Ace Ann Nyberg stepping in with our coverage on, and we're watching this live happen as Lifestar about to take Fotis Dulos to New York for treatment.
Doctor, what happens once the helicopter arrives at Jacoby? What happens?
Well, I guess I can't speak for Jacoby, but I expect that he will be brought to the emergency department first, and then just to make sure that his vitals are stable, and then from there he'll be transferred to the chamber, again with a critical care team that probably includes a nurse and a respiratory therapist.
Do some of the Hartford-based folks, do they go along and help begin this process in New York, or is it a complete handover to the folks in New York when they get there?
It would be a complete handover. So as soon as they touch down and put them on their gurney, they would give report to the receiving team, and that would be the end of it.
Okay.
Darren, I think you covered this, that he perhaps was without oxygen so long that things do not look good, Doctor?
I would say so. If the reports are accurate that he received CPR, that's a very bad prognostic factor. Anytime the heart stops, under any circumstance, is a bad thing, but particularly with carbon monoxide poisoning, it suggests that the injury was so severe and overwhelming that a complete recovery would be unlikely.
State police said as they looked in his garage window, they could tell instantly he was in distress. So apparently looked in and saw this car running. Unclear of what they saw, but we do know that they did work on him in the driveway of that home in Farmington for some time. So as we're talking to the doctor, there were initial reports that he had passed away. All of a sudden, there was a flurry of activity in Farmington, and an ambulance left with the lights on, followed by a police car. We don't know if there were no signs of life, and then the result of CPR. There were signs of life, some flutter of a heartbeat, but as you can see, this story now will make its way to the Bronx, to the Jacoby Medical Center.
They're about to take off, it looks like.
Yeah.
How long a ride is this?
It shouldn't be that far. I mean, I don't know the exact time here. Doc, are you familiar with, you've been involved with transporting patients to this place before?
I have not, no.
Okay. How many medical personnel normally on a trip like this? How many people in the back of that chopper? You have any idea?
2 or 3.
Doctors?
Usually 2. No, they're specially trained flight paramedics. So most of them our paramedics with additional training to fly, and often our respiratory therapists as well.
And of course, the pilot and the EMTs and everybody else on board is in contact right now as they're about to lift off with Jacoby, so their team will be ready, I would think, right there on the top of the building to whisk him away.
There you go. Life Star taking off. Fotis Dulos' journey to the Bronx underway, where just over 3 hours ago now he was found apparently near death after trying to kill himself in his garage in Farmington. Now, attempting to medical personnel here and in New York trying desperately to save his life. And off goes the chopper. Doctor, we appreciate your time. Dr. John Delgado from Hartford Hospital, a toxicologist. We appreciate your time today. Thank you very much.
You're very welcome.
Thank you, Doctor.